Uh, well, what I tried to do in discussing novel crystal growth inhibitors is first to speak to the question of how do we characterize inhibitors, because there are various processes of crystallization. Different chemical compounds have influences on the nucleation, growth, and aggregation separately. So I spent time introducing these concepts and then talked about two classes of inhibitors. Small molecule inhibitors, citric acid is the common one that's used. There is a recently published article on hydroxycitrate, which is an organically available chemical that has similar effect. But the data are not present yet as far as what its influence on patient care would be. The other area, my special area of interest is in polymers, and I've done experiments looking at synthetic proteins as well as other polymers that are actually much more potent inhibitors of the crystallization kinetics, and showed data to illustrate that. And I am aware of at least two companies that are interested in developing such products using different chemical structures than I tested. Inhibitors are useful in reducing symptoms and helping to control the disease, as we just saw in the parent presentation today, that if we have better inhibitors, patients would have fewer episodes, maybe could get by with wider excursions from their massive fluid intake that's required to control the disease. I think some of the other therapies offer greater possibility of cure, but the inhibitors are a useful area in manipulating the disease and reducing morbidity, as they'd say, I guess.